All right. Good afternoon again, everyone, and welcome again to Cybid MD's Telemedicine to the Rescue at the Time of Crisis webinar. I welcome all of you and thank you so much for joining us today. So, we have with us today Miss Tiana Crane with us. Miss Tiana is graduated in healthcare administration and currently she's pursuing with her MBA. She does have a 20 years of experience in the healthcare industry. She has worked with multiple specialties such as behavioral health, neurology, family medicine, internal medicine, obstetrics, gynecology, and many other more. She is certified with ERISA specialist with experience working with the DOL and the OIG. She is currently serving Cybit MD clients with the practice management consultation. So without any further delay, I welcome and present you Miss Tiana Crane. Tiana, over to you now.
Thank you so much, Susan. Thank you and welcome everybody to this webinar. I wanted to do this webinar because I've had many people ask questions about telehealth and how what's going on with telehealth right now and the different changes with the COVID-19. So just to start a little bit, we're going to talk about CyberMD. CyberMD is a healthcare information technology solution provider that offers to physician practice a comprehensive product service portfolio of revenue cycle and practice management solutions. We offer fast, effective document workflow, timely credentialing and enrollment, guarantee the highest returns. We have a cloud-based data management services and round-the-clock support, ensuring all satisfaction. So on the agenda, we're going to discuss frequently asked questions about telehealth. We're going to talk about what exactly is telehealth, telehealth before COVID-19, and telehealth to the rescue at this time of crisis. We will also discuss who can provide telehealth services, the no imposition of penalties, communications, and the HIPAA and BAA compliance, and the billing for telehealth services and billing for COVID-19. And at the end, we'll also have a question and answer session so we can go over your specific questions. And then also we have a nice little gift at the end of our webinar as well. So the frequently asked questions about telehealth. How is a telehealth visit encounter billed? That's a question that's asked a lot of times. And will you get paid for doing telehealth services? What are the contracted rates with payers and in-clinic services and state regulations? What are the plan terms? What, if any, are the financial obligations a patient may have? So we're going to discuss all of this in this upcoming webinar. Telehealth billing before COVID-19. So CMS had different requirements for telehealth before the COVID-19 emergency. There were certain things that you had to meet. You had to be eligible, originating site, and distant site restrictions. It was only available for patients that were in rural areas. If there was a health professional shortage area, established relationship requirement. So you couldn't build an initial visit with the telehealth. You had to be an established patient, and then you can build telehealth. It had to be synchronous and only reimburses for live telemedicine. And asynchronous, and that's a store and forward telemedicine. That's for Hawaii and Alaska only. Telehealth to rescue at the time of crisis. Telehealth is on the forefront for the global pandemic for COVID-19. It's actually being encouraged to do telehealth to reduce the exposure to the coronavirus. We're now connecting patients and healthcare professionals. We're saving lives by reaching out to those patients that are in need. And the billing challenges are due to the public health emergency for the COVID-19 outbreak. So there have been questions about who can actually provide telehealth services. Well, physicians, nurse practitioners, physician assistants, nurse midwives, certified nurse anesthesists, clinical psychologists, clinical social workers, registered dietitians, and nutrition professionals. All these people are able to provide telehealth services. No imposition of penalties. So the Office of Civil Rights will not levy any penalties in case of noncompliance of HIPAA security policies due to the public health emergency. They are allowing use of non-public facing audio video communication technology. Provisions apply to both COVID-19 related and E&M health related issues. You can now use Apple FaceTime, Facebook Messenger video chat, Google Hangout, Zoom, or Skype to do these televisits. You must inform the patient about the privacy risk if you're going to be using these different platforms. You have to enable the encryption and privacy option. Public-facing applications not allowed, like Facebook Live, Twitch, or TikTok, etc. Those are not allowed, but the other ones are. There have been questions about what telehealth platforms are available. So here are the following video communication products that are going to be in the HIPAA BAA compliance. Skype for Business, UpDocs, VC, Zoom for Healthcare, Doxy.me, Google G Suite Hangout Meets. But there's a disclaimer, but according to this notice, healthcare providers using other communication products that are not compliant with HIPAA, they will not be penalized. So it's whatever is available to you, but these are a list of platforms that are HIPAA BAA compliant. So before telehealth services, these were the codes that were used. Before billing for telehealth services, these are the codes that can be used with full video audio support only. So you can still use your regular office visit codes, the 99213, 99214, 99215, 99203, 99204, 99205. So new and established patients, you can still bill for those. Billing for other telehealth services. This includes telephone support only, e-visit communication through patient portals, review of records electronically with another provider, communication with other providers while sending them a report. And we do have a session where you can put your questions and answers on there. So if you have any questions during this webinar, just go ahead and post your questions and then we'll try to answer them as I go, okay? Summary of Medicare telemedicine services. We use Medicare because this is a general platform. I do need to warn you that each commercial plan, they vary. So for Medicare, these are the standards that they use for the billing. So for Medicare telehealth visits, a visit with a provider that uses telecommunication systems between a provider and a patient. You can bill the codes 99201 through 99215 for office visits, G0425, G0427 for telehealth consultation, emergency department, and initial patient or initial inpatient, G0406 through G0408, so follow-up inpatient telehealth consultation furnished to beneficiaries in hospitals or SNFs. And also, if we have some people that are in home health or hospice, you're able to ask questions about specifically for those codes that relate to home health and hospice as well. For a virtual check-in, this is a brief 5 to 10 minute check-in with your practitioner via telephone or other telecommunication device to decide whether an office visit or other services are needed a remote evaluation of recorded video or images submitted by an established patient. You can use the code G2012 or G2010. Okay, then for e-visits, a communication between a patient and their provider through an online patient portal. So this can be billed as 99421, 99422, 99423, G2061, G2062, and G2063. Okay. So there was a question, can you bill 99211 or 99212 for telehealth? Yes, you absolutely can. And I'm going to go to the next one. So for billing for telehealth at distant site services during the public health emergency, I urge everyone to check CMS daily because they're constantly making updates on the newsletter, the website about what can be billed and how to bill it with CMS. And this will give you kind of an idea with the commercial plans as well, because commercial plans tend to follow the CMS guidelines. So CMS will now allow 80 plus additional services to be furnished via telehealth. 80 plus additional services to be furnished via telehealth. The billing data service of a professional telehealth services are on or after March 1st, 2020. It is for the complete duration for the public health emergency. So during this time period, you're able to use your place of service equal to what would have been the service, would have been used for the services that were furnished in person. So if you're going to be using, let's just say an in-office visit, and you use the place of service of 11 for office visit, then that's going to be the same place of service that you're going to use for telehealth. And then you're going to have a modifier 95 to indicate that this is a telehealth visit. So you will use the same place of service as normal, but you'll do it with a modifier of 95 for Medicare. CMS is not asking for a CR modifier on telehealth services. However, there are two scenarios where modifiers are required on Medicare telehealth professional claims. It has to be furnished as part of a federal telemedicine demonstration project in Alaska and Hawaii using asynchronous store and forward technology using a GQ modifier. Furnished for diagnosis and treatment of an acute stroke, use G0 modifier. There are no billing changes for institutional claims. Critical access hospital method 2 claims should continue to be billed on with the modifier GT. Okay. So there were questions about how the COVID lab test should be coded using the following procedure codes. These tests are no charge to all members. So you're going to use U0001 for the Center for Disease Control and Prevention, 2019 Nova Coronavirus Real-Time RT-PCR Test Panel. Use U0002 for private labs. Use 87635 for infectious agent detection by DNA or RNA, severe acute respiratory syndrome, coronavirus 2. E0467, billing for multifunction ventilators under the COVID-19 public health emergency. Here's a couple of examples of ICD codes, ICD-10 diagnosis codes. So if you're concerned about possible exposure to COVID-19, but ruled out after evaluation, you're going to use 03.818. Actual or suspected exposure to someone who is infected with COVID-19, Z20.828. If it's a confirmed coronavirus diagnosis, you're going to use B97.29, other coronavirus as the cause of disease classified elsewhere, or you can use B34.2, coronavirus infection unspecified. On or after April 1st, 2020, you're going to use U07.1, 2019-NCOV, acute respiratory disease. A case of acute bronchitis confirmed as due to COVID-19, it's going to be J20.8. Cases of bronchitis not otherwise specified due to COVID-19, it's going to be J40. And then after October 1st, it'll still be J40. And that's going to be bronchitis not specified as acute or chronic. And on or after April 1st, 2020, U07.1. Cases of lower respiratory infection not otherwise specified or an acute respiratory infection associated with confirmed COVID-19, you're going to use J22. And that's unspecified acute lower respiratory infection, and B97.29, other coronavirus as the cause of disease classified elsewhere. And then, of course, after these dates, those codes change. Cases of respiratory infection due to COVID-19, you're going to use J98.8. Cases of acute respiratory distress syndrome due to COVID-19, it's going to be J80. And then B97.29, other coronavirus as a cause of disease classified elsewhere. So here, I'm going to open it up for questions and answer session. Okay, let me open this up. You said that the code 992 could be used for telehealth, but lots of insurance companies are rejecting them. Do I need to add the G code as well? Dorothy, could you expand on your question? I'm seeing 992 and then ... Are you referring to an office visit? Okay, for the office visit, for commercial, you do the 992, whatever the office visit level code is, and then there was you don't use the modifier 95 on that one. Let me get clarification on that. Just a moment. Dorothy, are you billing with a modifier, or are you just billing with the regular office code 99213 with place of service 11? not seeing anything. Okay, so if you're billing with the 99213, then you need to use a 95 modifier with that for the office visit. You can email me later, or we can chat offline and we can discuss the rejections that you're receiving for the telemedicine, and we can look and see exactly what's going wrong and what payers are rejecting those claims. Oh, it needs to be a GQ modifier. Okay. Dorothy, well, let's contact me after the session, and then we can discuss and we can look over what you're getting the rejections for. Okay, let me look in the chat. Teresa, this webinar I said that it was specifically for telehealth. So this was shared with different people. It can be for psych MPs, it can be for family MPs, it could be for home health, hospice. It's just a general webinar to go over the billing for telehealth services, what's changed after COVID-19. If you have specific questions, you can feel free to reach out to me as well. We can talk about that offline, because I can help you out with that as well. Okay. All right. Are there any other questions? Okay. I'm not seeing any other. Oh, there's some that just popped up. Just a moment. Yes, PowerPoint will be available to you after this session. You'll get a copy of this as well. No problem. Are there any other questions? How do you manage care of patients in rural areas if unable to address via video and audio? You can do an audio call. Medicare is actually allowing for just audio calls. There are different codes that you use for just an audio session, but we can provide that for you, Crystal. You can just do just a simple phone call, and then you can address the needs of the patient through a phone call. Okay, so Jennifer is asking for the 99212 rejection, what payer is she finding this with? Dorothy, what payer are you finding this rejection with, like common rejection? Okay. So there's not a response yet, but that's something that we can actually talk about in the group. If you for private payers would still use. Okay, for critical access, For the private payers, you can use the 95 modifier. Okay. And Jennifer, I can hold a separate session, and we can talk about with Dorothy those codes that are being rejected for the 99212. We can discuss that, and we can figure out what payer is rejecting it, because Dorothy might be in a different state, and it might be a different rules in her state. So we'll just check and see what's going on there. Okay. Do we have any other questions? Okay, I'm leaving it open. You can contact us at any time if you have any additional questions outside of this webinar. And would also give in a special offer today. So for the attendees that want to sign up for billing services today, we're offering a $500 discount. We can help you with your billing. We can help you with credentialing. And I did say that I will be answering any credentialing questions today as well. So if you have any credentialing questions that you want to ask me, then you can contact me at Tiana.D as in dog at Cybrid, and that's SYBRID.com. And I'll repeat that. It's Tiana, TIANA .D as in dog at Cybrid.com. You can contact me and you can let me know any of the questions that you may have. And also, I'll go ahead and give out my phone number. It is 469-548-4897. Again, that's 469-548-4897. You can reach me and you can ask me any questions that you may have, and I'll be there ready and available. Thank you so much for attending this webinar, and I hope that we can be an assistance to everyone during this time of crisis. Thank you.